Nimesulide is a nonsteroidal anti-inflammatory drug NSAID that is primarily used for its analgesic pain-relieving, anti-inflammatory, and antipyretic fever-reducing properties. Here are some key points about its pharmacology. 1. Mechanism of action. Nimesulide works by inhibiting the activity of an enzyme called cyclooxygenase COX. Specifically, it selectively inhibits COX-2, which is involved in the production of inflammatory prostaglandins. By reducing the levels of these prostaglandins, Nimesulide helps to alleviate pain and inflammation. 2. Anti-inflammatory. Nimesulide's primary action is to reduce inflammation, making it useful in conditions like arthritis and musculoskeletal disorders. 3. Analgesic. It provides pain relief by reducing the perception of pain and lowering pain-related symptoms. 4. Antipyretic. Nimesulide can lower fever by reducing prostaglandin production in response to pyrogenic, fever-inducing substances. 5. Selective COX-2 inhibition. Unlike some other NSAIDs, Nimesulide is more selective in inhibiting COX-2, which is associated with inflammation, while sparing COX-1, which is involved in maintaining the stomach lining and platelet function. 6. Pharmacokinetics. Nimesulide is generally well absorbed after oral administration and reaches its peak blood concentration within a few hours. It is metabolized in the liver and eliminated primarily through the urine. Pain and inflammation. The typical starting dose for adults is often 100 milligrams twice daily. In some cases, a higher starting dose of 200 milligrams may be prescribed, followed by a lower maintenance dose. Fever reduction. For fever reduction, the usual adult dose is 100 milligrams taken as needed, with a maximum of 200 milligrams in a 24-hour period. Osteoarthritis and rheumatoid arthritis. The dosage for these conditions can vary but is often in the range of 100 milligrams to 200 milligrams twice daily. Nimesulide, like other nonsteroidal anti-inflammatory drugs NSAIDs, can have side effects. The most common side effects associated with Nimesulide use include 1. Gastrointestinal effects. Nausea. Some people may experience feelings of nausea while taking Nimesulide. Indigestion. It can cause indigestion or dyspepsia, leading to discomfort in the upper abdomen. Gastric irritation. Nimesulide, like other NSAIDs, can irritate the stomach lining and, in some cases, lead to gastritis or ulcers. 2. Central nervous system effects. Headache. Headaches can occur as a side effect of Nimesulide use. 3. Skin reactions. Rash. Some individuals may develop a skin rash or itching. 4. Liver effects. Elevated liver enzymes. In rare cases, Nimesulide may cause an increase in liver enzyme levels, which should be monitored by a healthcare provider. 5. Renal kidney effects. Decreased kidney function. Prolonged use of Nimesulide can affect kidney function in some individuals. 6. Allergic reactions. Hypersensitivity reactions. Although rare, Nimesulide can cause allergic reactions, including severe skin reactions or anaphylaxis, a severe allergic reaction that requires immediate medical attention. 7. Cardiovascular effects. Increased blood pressure. Nimesulide can lead to elevated blood pressure in some individuals. 8. Gastrointestinal bleeding and ulcers. While less common than with some other NSAIDs, Nimesulide can still increase the risk of gastrointestinal bleeding and ulcers, especially with long-term or high-dose use. Nimesulide can interact with other medications and substances, potentially leading to adverse effects or reduced effectiveness. Here are some common interactions to be aware of. 1. Other nonsteroidal anti-inflammatory drugs NSAIDs. Concurrent use of multiple NSAIDs, including Nimesulide, can increase the risk of gastrointestinal bleeding and ulcers. It's generally advisable to avoid using Nimesulide with other NSAIDs. 2. Anticoagulants, blood thinners. Combining Nimesulide with anticoagulants like warfarin or antiplatelet medications like aspirin can increase the risk of bleeding. Close monitoring and dosage adjustments may be necessary. 3. Corticosteroids. Concurrent use of nimesulide with corticosteroids can increase the risk of gastrointestinal ulcers and bleeding. Your healthcare provider may prescribe additional medications to protect the stomach lining if this combination is deemed necessary. 4. Antihypertensive medications. Nimesulide can reduce the effectiveness of some antihypertensive medications, potentially leading to increased blood pressure. Regular blood pressure monitoring is important if you're taking both types of drugs. 5. Lithium. Nimesulide can increase lithium levels in the blood, potentially leading to lithium toxicity if you are taking lithium. Your healthcare provider may need to adjust your dosage and monitor your lithium levels closely. 6. Diuretics. Diuretics can reduce kidney function, and when combined with nimesulide, it may increase the risk of kidney problems. Regular monitoring of kidney function is advisable. 7. Methotrexate. Concurrent use of nimesulide with methotrexate, a medication used to treat certain autoimmune conditions, can increase the risk of methotrexate toxicity. Dosage adjustments and monitoring are necessary when using these medications together. 8. Alcohol. Alcohol consumption while taking nimesulide can increase the risk of gastrointestinal bleeding and ulcers. It's generally recommended to avoid alcohol when using this medication. 9. Certain antibiotics. Some antibiotics, such as ciprofloxacin and levofloxacin, can interact with nimesulide and increase the risk of seizures. This combination should be used cautiously, and your healthcare provider should be informed.